Hey everybody, this is Dr. Lori Langdon again, board certified pediatrician, mom to 6 and grandmother to 2, with a very quick video to answer a commonly asked question, and that is, does my teenager need a sports physical before they play sports? So let me explain something. The phrase sports physical is a little pet peeve of mine. Now, absolutely, yes, your child needs a complete pre-sports participation physical examination. It's just that a lot of people, even I've dealt with like secretaries and things in the healthcare system, think, oh, it's just a quick sports physical. We can just squeeze it in like a sick visit. Okay, that's the pet peeve part. No. They need a complete well child check. They need to have their height and weight plotted in their growth charts that we've been watching for years. They need to see the pediatrician that they have a relationship with through the years. We need to be able to do our routine screening for mental health problems. We're seeing so much of those. We need to be able to explain to them all the heart healthy habits. We need to have some chatting with them alone to ask about high-risk activities they may be participating in or experimenting with. We need to have a relationship with the family. We don't need you to take that teenager to an urgent care center who advertises, we do sports physicals. All that means is they check their height and weight and blood pressure and sign off the form. That doesn't mean that they did a really good job with mental health screening or anticipatory guidance provided to that teenager or developed that rapport and relationship through the years. It's just not the same. So I want to discourage you from doing urgent care sports physicals. I want to discourage you from doing those in the gym. A very well-intentioned person comes in and checks 200 student athletes in one afternoon. You must see that that can't possibly be high enough quality health care. It's not in their chart. That person doesn't have access, that well-intentioned healthcare provider in the gym doesn't have access to your individual child's past medical records. That's a problem. I once was sort of roped into doing one of those situations, and we had a child with a huge well-heeled linear sternotomy incision, which is almost always from open heart surgery, there to get us to sign off on his sports physical. No, that's a hard no. So please understand, your child needs a complete well child check once a year, even as a teenager, especially as a teenager. We have so many things to talk about. And so I want for you to remember, if you have had your routine well child care and your child's had a regular physical within the last year, your pediatrician, I can sign off on that sports physical form. So it doesn't mean you have to have your routine yearly well check plus a middle of the gym or an urgent care center sports physical. Absolutely not. A once a year, routine, comprehensive well child check is what all teenagers need. Thanks. And oh my goodness, I forgot to say vaccines. When your child's seen in the middle of the gym or at urgent care, they're typically not going to have access to their immunization record. That is critical, and it's super important because this is when we catch those teens prior to sports participation so we can make sure they are up to date on their immunizations. This is extremely important, and just one more reason why you should get your routine yearly well child care at your pediatricians.